I would say that one of the big problems with the fact that we have this contamination in Gaza of the coastal aquifer and an expanding population and consumption much higher than production is that 90% of the water now for drinking is purchased or comes from desalination plants, and that's very costly for a population which is really struggling economically, and also it has there are greater risks in terms of waterborne disease. I'm afraid I can't sort of comment on DFID's input, but I would just like to go back, if possible, to a couple of other relevant questions.
Very briefly. We run out of time in 2 minutes.
One of which was just about the costs in Gaza, just to underline in terms of the emergency, the current emergency, those costs are going up exponentially week on week. Just to give you a quick idea, just for 22 tailor spatial frames, which is to stabilise the leg, that cost us over £200,000, and it was a 50% discount. So the equipment that's required for this is incredibly expensive in terms of the kind of care that's needed. And that's on top of the shortages of medicines. And one of the things I would say for DFID in terms of spending is that all of the focus now, or a lot of international focus, is on the emergency and not on the development issues that underlie the crisis in Gaza as well.
No, thanks.
So we would hope that there would be, in terms of a strategy going forward, that in dealing with this emergency, those long-term development goals are also addressed. And one example is our limb reconstruction programme, which was set up in 2014 after the emergency of the war in Gaza in 2014, and that has built the capacity and has established a limb reconstruction unit in Shifa Hospital that is now able to deal with complex surgeries. Now, it's not enough to deal with what's coming in now, but any support that is coming through, we would ask for all international support that's coming to deal with this emergency, that they work with the local expertise that has been established there in order to coordinate and ensure that when their support is pulled out, because it's unlikely that they will be there for the 12 to 18 months in terms of their emergency support, the local medical teams are able to provide a continuum of care.